With a population of approximately 52 million people, South Africa is a country bursting with potential. As the second largest economy in Africa, the country has shown tremendous growth in most sectors since attaining democratic independence in 1994. In the health sector, for instance, the South African government has made great strides over the years in the fight against HIV and AIDS. With over 2 million people on treatment, the country has the largest antiretroviral program in the world. The availability of medicine in all public health facilities is at the heart of the country's priorities in service delivery. Complex systems and processes are required to ensure universal access to medicines in a country that spans over 1.2 million square kilometers, comprising communities living in urban, peri-urban, and rural settings. The responsibility of ensuring correct medicines selection, procurement, distribution, and ultimately the way they are used by the patients falls largely on the shoulders of pharmacists. The magnitude of these tasks requires public sector pharmacists to not only be good at caring for their patients, but also to be effective managers and leaders. Management Sciences for Health, MSH, is a global health non-profit organization. We use proven approaches developed over 40 years to help leaders, health managers, and communities in developing nations build stronger health systems. MSH works to close the gap between what is known and action in public health. Our approach is also such that we start with what communities have, and together with them, we build stronger health systems. MSH has been working in South Africa since 1997, providing technical assistance to strengthen health services. One of the many projects that MSH South Africa runs is the Systems for Improved Access to Pharmaceuticals and Services, with the acronym SIAPS. SIAPS is a USAID-funded program with the aim to provide access to quality pharmaceutical products and stronger pharmaceutical systems in order to produce a stronger and healthy nation. We believe in extensive consultation and the development and implementation of a set of technical interventions that focus on systems strengthening and building local capacity. The overall goal of the SIAPS program in South Africa is to strengthen the capacity of pharmaceutical systems at all levels. This is done to support the government's priority health programs and initiatives. One of SIAPS's key programmatic areas is the Pharmaceutical Leadership Development Program, the PLDP. Realizing some capacity building challenges in South Africa's pharmaceutical system, SIAPS leveraged MSH's Proven Leadership Development Program, LDP, to improve leadership, management, and governance practices in the health system. In 2011, the LDP program was adapted for South Africa's pharmaceutical system, creating the Pharmaceutical Leadership Development Program, the PLDP.
The Pharmaceutical Leadership Development Program, also known as the PLDP, is a program that is aimed at strengthening leadership, management, and governance skills for pharmacists and pharmacy managers. Through a series of training workshops and coaching visits, the PLDP combines technical pharmaceutical knowledge, such as advanced medicine supply management, legislation, governance, ethics, human resource management, financial management for pharmaceutical services, and pharmacoeconomics, with leadership and management practices so as to better equip the pharmacists and pharmacy managers to effectively and strategically manage challenges that they come across in the workplace. Using a team-based approach, participants tackle a real workplace challenge that affects the delivery of pharmaceutical services. Participants are guided through a process of creating and sharing a vision, of defining a measurable result, understanding their current situation, analyzing root causes to the current situation, selecting priority actions, and then developing a realistic action plan. Teams then implement the plan. They monitor and evaluate progress towards attaining the measurable result, and then present the results to senior managers and other stakeholders within their facilities, their district, and the province.
The PLDP program, I found it to be an excellent program. The reason is that the practicality of it and the on-job training that it brings you to, it's more beneficial. It really puts you into the job. It gives you that experience and it gives you the confidence to can challenge your tomorrow, so to say.
Pharmacists are empowered to mobilize local resources, monitor results, and improve their work environment. During the training, participants learn and apply the leading and managing practices of scanning, focusing, aligning and mobilizing, inspiring, planning, organizing, implementing, monitoring and evaluation in an integrated manner. This empowers the participants to effectively improve the climate within their work environment, to improve management of systems and processes within their work environment, to better respond to changes within their work environment. And this will enable them to improve delivery of pharmaceutical services and ultimately to improve patient outcomes. Participants are required to work in teams to develop an action plan and to implement that action plan back in their workplace. When they leave the program, they have solutions and skills on how to address challenges that face them in the workplace.
To date, the PLDP has been implemented in 8 of the 9 provinces in South Africa. 151 pharmacists have participated in the program. 238 facilities have implemented quality improvement projects using the PLDP approach.
Quality improvement interventions that have been implemented by the teams have focused on reducing patient waiting times, improving availability and accessibility of medicines, improving compliance with national core standards, and improving rational medicine use. Results achieved have been positive across the facilities. For example, in the Northwest, pharmacists supported 10 primary healthcare facilities on the development of standard operating procedures, distribution of reference manuals, and capacity building in good pharmacy practice, including medicine supply management, and this has resulted in an increase in compliance with national core standards from 33% to 77%. A hospital in the Eastern Cape, for example, implemented a batch management system, resulting in a 3.1% reduction in expired stock as a percentage of expenditure. Compliance with standard treatment guidelines for the prescribing of non-steroidal anti-inflammatory agents was improved from 57 to 94% and 60 to 68% at 2 hospitals, and then from 37 to 67% at a community healthcare center in Ilembe district in KwaZulu-Natal. The accessibility of chronic medicines to communities around GJ Crooks Hospital in Ugu district in KwaZulu-Natal was improved. 3 community-based collection points for chronic medicines were established, and this was all as a result of interventions implemented by pharmacists and pharmacy assistants from the GJ Crooks Hospital. SIAPS and the heads of pharmaceutical services are now exploring ways of scaling up and sustaining successful interventions, as well as using the PLDP approach to address challenges. An example is in KwaZulu-Natal, where 13 districts are now scaling up and applying the successful interventions that have been implemented and are applying the PLDP approach to address workplace challenges. These are only a few examples of how the PLDP has translated into real change. These vary from improvements in customer service and from making medicine accessible and available to patients.
The skills that I've amassed from that project, they've benefited this pharmacy a lot. Firstly, in terms of the stock availability, we have seen some serious improvements on the stock availability because we are able, from that particular skill that I've learned, I'm able to track each and every aspect of the stock that is needed in the pharmacy. I'm able to track all the necessary preventative measures with regard to the expired stock. I'm able to track as well the workings in the pharmacy, basically as to each and every department, as and when they work. I'm able to actually follow up and monitor and evaluate the work generally in the pharmacy.
When we started this program, we wanted to improve access to medicines and pharmaceutical services. We wanted to do this by investing in the people who could make it happen. We were convinced that this was the way to go. Looking at the results that we have achieved, we can definitely say that we are heading in the right direction. We believe our efforts have strengthened leadership in the pharmaceutical sector. The program has enhanced the capacity of personnel to provide pharmaceutical services. It has improved the use of information for decision-making in pharmaceutical services. Beyond strengthening the leadership and management skills of pharmacists and pharmacy managers, one of our key successes with this program has been the close collaboration that we have had with government, with the local departments of health and local technical experts. Together, what we have done is to customize and tailor-make a program that meets the local needs and ensures the safe and efficient delivery of pharmaceutical services. Our aim was to work with the pharmacists, to build on what they already know, to strengthen their leadership and management skills, so as to ensure the efficient delivery of pharmaceutical services to our communities and our patients. We, as management sciences for health, are in the business of saving lives.